Neglected. That's how some doctors who are not working from COVID-19 treatment centers describe their situation, as some who recently came into contact with a coronavirus patient await their test result. A neurosurgeon, Dr. Hadi Abdullah, is one of them. He tells JoyNews his son refused to speak to him when he denied him water in his bed to shield him from the possibilities of an infection. First, Dr. Abdullah makes a case for even distribution across health facilities and also to include health workers who are not stationed at COVID-19 treatment centers to prevent what he describes as silent infections.
Beginning to see patients who are coming to see us with, say, different ailments, but could have been COVID positive, and unnecessarily expose us. Unfortunately, the difference between us and those working at the treatment center is that they have all the cover, because nobody really identified us as a risk group. So we were not provided with the PPEs. I've had my samples taken, all my colleagues have had their samples taken. And the danger is that some of us work in a highly specialized areas, that when we have just a single exposure, the whole unit may have to be closed down. I'm a neurosurgeon. Today I've had calls from several colleagues around the country who want to send patients who have bled into their brain, who need emergency surgery. My call is that, look, the PPE should be made available to every worker, every healthcare worker who is working at the clinics and the emergencies, because that is where the danger is. That is where the danger is. I tell you what, this same patient that some of us were exposed to, we saw the patient without the necessary PPE, okay? But the moment we called the public health team, they came in full PPE. And this is a patient we've been exposed to as close as 3 weeks. We just have to pray that none of us came positive. If we don't take the issue of the PPE very seriously for workers like us, we're going to have lots of healthcare workers getting exposed. They will be going home with the viruses and will be silently infecting the communities without knowing. There are healthcare workers who are being picked from our various hospitals in public transport every day. Every day we have nurses, doctors sitting in the Ayalolo bus. We don't know which nurse is affected. But for the fact that they work in hospital and are not at the treatment centers, they are not getting enough protection. And that is where the danger is, because if any of them get infected, they are still going to the communities. That is the danger. Those people have been neglected. They have been really neglected. I on my own decided that I was going to buy my own face masks and PPE. So I bought my own N95, which I encourage my junior colleagues to do the same.
Dr. Abdullah has an appeal, especially for Zongo communities, on the usage of their washing kettle, popularly called buta. He speaks in Hausa and translates just for great comprehension.
Coronavirus with COVID-19. Yanzu ciwo nan na gari ya hali tudu ma duka an samu mutane da ke da wannan ciwo. Yankuri ina roƙonku a bari zuwa masalaki ana sallan jama'a, a bari wannan in ka je wani buta kuma na nan da ka yi alwala da shi, ka yi kokari so ka wanke hannunka da ruwa sannan ka taba wannan buta. Sannan ina roƙon yawanmu da ke Nima da Mamobi da Ashama da Nungwa Zongo da zonganinmu duka ina roƙon ku, ciwon ga gaskiya ciwon nan yana nan cikin garin nan. And yara na mutuwa da ciwon ga, manya na mutuwa da ciwon, kowa ya yi mutu. And what I said is I'm appealing to my people from the various Zongos, including like my Muslim brothers and sisters, and that they should desist from congregational prayer, which has been banned. And the fact that I am aware that people are still even praying in congregation at home, which is not good. And there's a typical kettle that we use for ablution called buta, which several people can use at a time. I'm appealing, if you have one at home, just know that this virus is real. And as much as possible, we should wash our hands with soap before touching the kettle to start our prayers. Our ablution. And when you finish, you should do same. And if possible, we should avoid using it at all, and can use tap water, or you can buy sachet water and let somebody pour it for you whilst you perform the ablution.